To the Western Cape, localised restrictions may come into effect this festive season. As the province records a resurgence in coronavirus cases, stricter regulations are expected to be announced this week. And as ETV's Natalie Malgas reports, Cuban doctors are staying and KZN nurses are on their way to help.
The dramatic uptick in coronavirus cases along the Garden Route resulted in the area being classified a COVID-19 hotspot.
Coronavirus cases are outpacing all attempts to control it. There are now more active cases in George and surrounds than at any point during the pandemic to date. Officials say these statistics are still gaining momentum just as the December holiday migration kicks off.
The areas of biggest concern are Naislabito, which is on the Eastern Cape border. Then heading this way is the George sub-district. And then second to or third to that would be Mossel Bay sub-district, where we are seeing the largest number of new infections. And it could be because our populations are a bit more dense in those areas. It could also very well be because these are the areas that are frequented by tourists when they travel throughout. And obviously people commute because after the lockdown has eased up some of the regulations, people have ventured out.
It's in these areas particularly that the provincial government is mulling over isolated restrictions to break the hold this killer virus has on the rural district. It's hoped stricter regulations will ease pressure on the overburdened public health system.
George Regional Hospital is at capacity at the moment. They have some spare capacity available. They have increased their bed capacity in terms of freeing up other beds in other wards. At the moment they are coping, but they are barely coping.
Meanwhile, interprovincial staffing requests have been made for nurses from KwaZulu-Natal. 2 Cuban specialist doctors have also been retained at Knysna Hospital to lend their expertise until the end of May next year. Natalie Malgas, George.